So hi everyone, welcome to NATCO Studio Room. On behalf of Indian Society of Critical Care Medicine, today we are being with Dr. Kiran from Rangaraya Medical College. So welcome to the NATCO Studio Room. Welcome sir. We are here to share your knowledge to each and everyone. The younger generation are so desperate to know about your knowledge and the wisdom. So my first question is, how does ceftazidime avibactam compare to meropenem in treating MDR infection?
Ceftazidime avibactam is a good drug compared to meropenem because there is high instance of carbapenem resistance which occurs in hospital patients, and also there is some amount of carbapenem resistance in the community as well. But as far as ceftazidime avibactam is concerned, it has to be used with due action because the incidence of resistance is increasing, and it is good for multi drug resistant carbapenem resistant organisms. We can use that in patients with Acinetobacter infection, and it should be always culture proven before we go ahead and put ceftazidime avibactam, not as an empirical therapy for carbapenem resistance.
All right. So thank you so much. And what are the clinical outcomes of patients with NDM producing infections?
NDM is a very big problem in India because of very high and irresponsible use of antibiotics. We do not usually use cultures based treatment strategies. Many of the antibiotics put in hospitals, small hospitals, are usually gut feeling that this might work, and putting a higher antibiotic might work for a patient even with a smaller infection or a trivial infection. So, to choose to have a very good perspective, NDM is named because it has been found in India, and it has been seen in many of the South Asia countries because there is a high instance of antibiotic abuse. So, NDM is a very big burden to all of us, and a proper antibiotic culture sensitivity or using your PCR technologies to find out what organism is there and what are the resistance pattern will help us in choosing the right antibiotic and prevent the rapid growth of NDM organisms.
All right. Thank you. And how effective is ceftazidime avibactam in treating complicated urinary tract infections in Indian setup?
It is a very good antibiotic, definitely. It covers multiple organisms, and it deals with very many carbapenem resistant organisms like NDM producers and OXA producers. But the problem is having a good culture sensitivity, and if it is sensitive to ceftazidime avibactam, and Acinetobacter being the very common hospital acquired infection, combining ceftazidime avibactam with aztreonam will help in good clearance of the infection, and provided you do a decent source control also. Complicated UTIs like maybe having a stone in the urinary tract, or there may be emphysema, pyelonephritis, or patient may be in sepsis. These should be dealt also accordingly rather than just putting an antibiotic, because even though you give an antibiotic, there may be instance of resistance if the source control is not adequately done. So, source control, adequate source control, apart from it culture based antibiotics, and if the organism is sensitive to ceftazidime avibactam and is resistant to other carbapenems, it is better to use ceftazidime avibactam along with aztreonam for a complete clearance of the infection.
All right. Thank you so much for sharing your wisdom with all of us, and this was really insightful to all of us. And yes, we are going to conclude NATCO Studio Room right now, right here. Thank you so much everyone for watching us, and thank you so much sir for coming here.